So why is gluteus minimus my number one legendary trigger point? Mostly because it is the underlying cause of so many of the pain presentations that I see in clinic. It's the smallest and deepest of the three gluteals, predominantly a lateral stabiliser, so it's used a lot in any one-legged position. For example, pushing up the stairs, single leg stance phase of walking, stabilising the whole hip when you impact while running on the landing leg. Look at its referral pattern down the legs. The lateral referred pain is often misdiagnosed as sciatica and the posterior leg as tight hamstrings, and the pain across the SIJ, sacrum and posterior pelvis region is nowhere near the glute min, so it's often completely overlooked and forgotten about. It can become a problem because of under and overuse. Sitting at a desk or in a car for hours twists and stretches this small, deep muscle till the blood flow becomes non-existent and the muscle is damaged, ergo trigger point, making sitting a major aggravator. Then the person stands up like a little old person because of the referred pain around the pelvis till they get the muscles moving and blood flowing again. Glute min also doesn't like overuse, and its job as a lateral stabiliser keeps your trunk straight while standing on one leg while walking. It even more so doesn't like running, as it has to work really hard at the impact of landing. So suddenly doing a lot more walking or running overloads the muscle and it fatigues and injures, leading to a trigger point and referred pain. This is often part of the issue with runner's knee. Other issues that it can be involved with include the pregnancy waddle and pelvic girdle pain. It can give you pain going up and down the stairs. It can give a deep pinching pain into the hip, posterior pelvis and also the sacroiliac joint area, especially on weight bearing. It can give you hip arthritic type symptoms and can also lead to trochanteric bursitis, as the trochanteric bursa is situated under the glute minimum, and the increase in tension can lead to pressure on the bursa itself. Testing the muscle. The leg across the body, hip adduction position will be very tight and blocked, and hip abduction will not hinge correctly at the hip and will appear weak and feel heavy. So treating glute minimum. You need to palpate the area for the trigger points, those little tight spots of muscle. Your client will definitely be able to tell you when you hit one because they'll feel bloody painful. You can massage it, but good luck because it's bloody deep, so yeah, get your thumbs right in there, or elbows if that's what you like to do. You can try lying on a tennis ball. Dry needling is my option of choice as a therapist. It saves your hands and you can actually get directly into the trigger point with a fairly long needle. Rehab will obviously include hip abduction type exercises, ones that stabilise. I'd work generally on the glutes in the whole, and also check the movement patterns and make sure that there's the correct balance between the glutes and the lumbar area muscles.